COVID-19 has had a major impact on all our lives and on healthcare across Europe and the rest of the world. And to discuss the impact of COVID-19 on transplant units and patients, we have prepared a few questions, and I go directly to the first one. How did COVID-19 impact your center? And we'll start with Anna Sureda, please.
We organize our daily life to try to minimize the visits of the patients into the hospital. And of course, we adapted the type of treatment that we were giving to our patients, taking into consideration the pandemics.
Everything was changed in order to minimize the contact between patients and health personnel. And the mentality of the health personnel also changed very much.
We stringently reorganized our activities. The first one was to protect our patients, since there were from the very start reports that COVID-19 could be more severe in patients with neoplastic diseases. The second one was to protect our personnel, so we established some rotation. And finally, managing some of the scarce resource, especially at the start of the pandemics, protective equipment, individual protective equipment.
Did you change which patients underwent stem cell transplant at your center? And we'll start with Anna.
We changed following the EBMT board indications and other international bodies. So we significantly decreased the number of stem cell transplantations, and this decrease was basically seen in those patients potentially candidates for allogeneic stem cell transplant.
We delayed, indeed, the non-urgent transplant, and we considered non-urgent transplant those with that have a low risk of relapse, particularly the multiple myeloma patients, and followed strictly the BMT guidelines about the
autologous transplant field was the one where we had to rearrange the healthcare path for a significant fraction of the patients. And the consequences on allotransplant and CAR T cells were more limited, and we are returning to normal now.
The next question is, what are the most important lessons learned? And I can say from the Stockholm Swedish perspective is that I would have never envisaged that we could change our healthcare, particularly the access to ICU, the way we were able to.
Our surprising capacity to be able to quickly adapt to this completely new situation for us. And I think that we have also learned how to better use telemedicine.
We need to take care of our healthcare system. The healthcare system is being doing very well, but we need more investment. And also, I would say that we need more research in viral diseases.
Not only do we need to take care of the healthcare system, we need to take care of healthcare professionals for them and also for the system to keep running.
In all our three countries, in France, in Spain, and in Sweden, there are numbers that seems to be increasing. What are you doing now to prevent COVID-19?
I think that we have to basically streamline what we have learned from the first wave and trying to minimize as much as possible the number of infected patients in this potential second wave.
We are doing PCR testing massively. We have changed the way we look after our patients with telemedicine mainly. And we, of course, need urgently a vaccine.
The virus is there to stay for a while, at least for a significant period of time, and we have to adapt and learn how to live with it. And as always, education is key to protect people, protect our patients.
I can only echo what Christian just said. This is not a sprint race, this is a marathon. Hopefully we will have a vaccine that is able to moderate the disease and decrease the spread, but we will still have to deal with the virus for a long time to come. And with that, I close this session. Thank you very much again.
Thank you.
Thank you very much.